privilege today to start out my first hearing as the chair of this committee. I'd like to take a point of quick personal privilege and thank and recognize our colleague Blaine Griffin for his tremendous work in this committee over the past couple of years. Councilman Griffin has really been a leader when it comes to health equity in our community. So it's an honor to take over this committee from him. And I just wanted to publicly recognize and thank him for his good work on this committee, as well as thanking our, the council president for this opportunity to chair this committee. So we're going to kick off this morning. We've got two major topics, and I believe, Madam Clerk, do we need to call the roll given that there's no legislation?
You don't, Mr. Chairman.
Okay, so we will not call the roll given that there is no legislation, but we will read our disclaimer for COVID-19 purposes. So good morning. This Health and Human Services Committee hearing is being held during the COVID-19 emergency declaration in accordance with Ohio's open meeting laws as amended by House Bill 404. This meeting is being held using the Zoom platform and is being live streamed on YouTube and on Cleveland's Channel 20. It can also be linked from the Cleveland City Council website and from Council's Facebook page. In accordance with Ohio open meetings regulations, as amended by House Bill 404, notice of this committee hearing was publicly posted. This committee hearing will be conducted as all committee meetings in accordance with the council rules and Robert's Rules of Order. The chair will facilitate the meeting and call on persons to speak. If you wish to speak, please use the raise your hand option on Zoom. Please limit your comments to the matters in front of today's committee. As is the usual practice, any actions to be voted on during this committee will be done by voice vote, called and recorded by the committee clerk as required by Rule 15. Again, there is no legislation for today. Alrighty. So good morning, everyone. This is, again, my inaugural committee, so I appreciate everyone joining us today, and I reserve the right to mess up a couple times on this committee as I get a hang of my first chairmanship on Cleveland City Council. But again, it is my privilege to chair this committee, and I'm very excited to do so. This is our first committee with myself as chair before the end of the year. We're going to hear about two topics this morning that I believe are of utmost importance, and I've heard feedback from council members as well as community members that they wanted to hear an update on these important topics before we close out this year's council session before the holidays. Those two topics will be an update on the COVID-19 virus. And then the second topic on the latter half of today's hearing will be the cold weather plan for our unsheltered population. So again, thank you for joining us. For the beginning part of today's discussion, we have guests both from the city, county, as well as our partners in the community. To introduce our guests, we will have Director Brian Kimball of the Cleveland Department of Public Health, Chief Natoya Walker Minor with the City of Cleveland, Commissioner Terry Allen of the Cuyahoga County Board of Health, Dr. Dave Margolius, who is the Director of General Internal Medicine for Metro Health. And do we have Director Butler with Neon on the line?
She had a conflict with the Board of Zoning Appeals. She may hop on if she can.
Alrighty. So we also invited representatives from Neon, who, of course, are a local partner in healthcare in the city of Cleveland to provide that perspective. So with that, I'm going to ask both Director Kimball and Commissioner Allen to provide a general update on the trends we're seeing in our community, as well as any important information that we should know regarding COVID. Where are we? What do the numbers look like? And what are we forecasting towards the end of the year and the beginning of next year? So I'm going to give the floor as a city council person to Director Kimball to take the first stab at this. But Director, the floor is yours. And from the city's perspective, where are we with COVID and what should the community know?
So thank you, Mr. Chairman, and good morning, committee members. Yesterday, we recorded our highest number to date. We recorded over 400 cases of positive cases in the city of Cleveland. That brought our total to over 13,000 positive cases. this has, we've seen a tremendous increase over the last 7 days. We've averaged nearly 250 cases per day. We are, we're seeing it from everywhere. We're seeing cases from children younger than 1 year old to our seniors over 100 years old. So this is very concerning to us. We continue to increase our staffing level to meet this demand. We've assigned or reassigned probably about close to 75% of our total staff to assist us in this battle. We've brought on additional temporary staffing to aid us in this. We're bringing on additional nurses also to help us in doing and addressing this. So that's where we are today. Commissioner Allen, you're going to kind of go over the projections as we know them.
We're happy to
Thank
do
you,
that,
Director. Go ahead, Commissioner. From the county's perspective, so thank you, Director, for that feedback. Commissioner, from the county's perspective, what are we looking at regionally? Please fill us in with that information as well.
Thank you, Mr. Chairman, and thank you, Director Kimball. We've been working, of course, with Brian for many years and lead poisoning prevention for many years, and of course, working very closely together during this pandemic response since March. So I know that, Ann, we do have that brief. If maybe we can just kind of walk through the brief. We can start at the top to kind of give people a sense of things. So we weekly publish these briefs. MMWR stands for Morbidity, Mortality Weekly Report. And so week 48 gives a sense of what happened the previous week, and we track trends. It's important to recognize that in this unprecedented surge we're dealing with, that we need to track the trends. Day-to-day numbers will fluctuate. The labs have been overwhelmed with the testing that's coming in with the significant numbers of people being tested. That data then has to be entered into a system that then goes to the state and then is sent around to local health departments for investigation. So we're amidst a surge, so there will be some lag in the data, but the trends are very clear. So within our jurisdiction, you'll see per last week, we had over 28,000 cases, and 7% of those folks are hospitalized. We also are seeing some new trends around ICU admissions, increase in ICU admissions. We'll talk about that a little bit, and Dr. Margolius can certainly provide the great details on that. But if we look at November, 55% of all our cases occurred to date in the pandemic in November. November has been an unprecedented surge in activity. And so this is very concerning to us. We know that when people come together, weather gets cold, they're closer together. There are a number of other respiratory viruses that circulate in the winter. And so that increases risk, of course, in the community. I'm very sad to report that we've seen an increase in fatalities. The previous week, an increase in cases, as I've mentioned, the county medical examiner, Dr. Gilson, in preparation, sadly, had to order additional refrigerated trucks in the event that we have an increase in fatalities based on the trends. So that's a very sobering statement for us to recognize that this is very serious business. We know as we're looking at these data countywide, we've had a total of combined between the city of Cleveland and Cuyahoga County's jurisdiction in suburban Cuyahoga County, 46,333 cases to date, 3,542 hospitalizations, and 781 of our friends, neighbors, grandparents, parents have died. And so it's important to recognize the toll of this. And there's a lot of tragedy that goes along with this, along with the myriad challenges in this pandemic. So if we can move down, Ann, a bit down the page to show folks some of the demographics. You'll see here, looking at our data here, we have about 45% of cases have been male and 55% female. We've had pretty consistent age group distribution there. What you'll see is the 20 to 29-year-olds are consistently the highest number of cases. And we do know that complications and highest risk, certainly for complications, are for people 50 and over. And the vast majority, 60 to 70% of our fatalities are people over age 70. But the drivers of the pandemic are those younger folks that do a lot of mixing and interacting. And certainly we're paying close attention to that. If we look at the race data county-wide, you'll see that 26% of cases are African-American, 54% white. We do still have a percentage of folks that don't provide data on through the system on their ethnicity or race. We have about 2% Asian and 6% other would be a combination of Latinx and a range of other race data. But what's very, very important to note here is that African Americans are have a 3 times greater rate of hospitalization than whites do, and are 1.7 times more likely to be diagnosed with COVID. So that disparity has been consistent throughout this pandemic. About 8% of cases are healthcare workers, and about 30% of people have pre-existing conditions. And so it's important to recognize if you've got asthma or diabetes or heart disease, that puts you at greater risk. When we're on the phone and we talk with cases, the big risk here is that people begin to have a range of symptoms from fever, but shortness of breath or difficulty breathing can lead to reductions in blood oxygen levels. And I've talked to countless people that are sitting in a hospital bed on high flow oxygen or at home with shortness of breath, that we've supported them through the health departments to give them, a little blood oxygen, what we call pulse oximeters, and Dr. Magolius can talk about this, so they can monitor their oxygen levels in their blood so they don't get in trouble. And we're very concerned about people's health and understanding this is very real. This is very real, and the next few months are going to be very difficult. Our hospital systems are incredible in this community, but we're concerned about the fact that many of them have had a lot of workers out due to COVID because of isolation and quarantine, affecting our ability to then serve the community for a range of needs that are essential. So, Ann, if we can go down the page a bit to show what we call our epidemiologic curve. And if we look at this curve here, basically what it shows us is cases per day since the beginning of the pandemic. And each line, as you go, you can see on the left, the number of cases per day ranges from 0 to 800. And then, of course, we see this spike that occurred in the summer. We saw mid-June to mid-July, a spike of cases that occurred. And then we had the mask order, which we believe had a significant impact on our cases, the mask order that was statewide. If we move down, you'll see this huge spike that's occurred here in the winter to the far right of the epidemiologic curve. And what happens in the last few days is the data trickles in, and there will be some changes and fluctuations, but the trends are very clear. We've had huge numbers, and Director Kimball talked about the number within the city of Cleveland. Countywide combined, we've been seeing it last week average 600 cases every day, 670 cases every day. And some days we've had over 1,000 cases come in our jurisdiction alone. And so recognizing that we've got on any given day, 90 to 100 people making calls with temps as the City of Cleveland Department of Public Health does, along with staff, and also utilizing the Ohio Department of Health additional staff. And every case can have 2 to 3 contacts, close contacts. So we're talking about huge numbers. We're talking about anywhere from 2,700 to 3,600 people a day that we're dealing with trying to contact. So we've had to triage. We've had to focus on people over 50 that are at risk. We focus on people in congregate sites like nursing homes and homeless shelters or in adult care homes. And so we want to make sure that we're also concentrating on people most at risk for complications, older folks, in order to continue to do the best we can to keep up with this unprecedented surge. So let's move down the page. As we move down the page, it's important also to note that we work together with the Cleveland Department of Public Health to track flu in the community every week. And I'm happy to report so far, flu has been very, very low. So we want to tell people you can still get your flu shot. Go to your pharmacy, go to your doctor, go to your health department, get your flu shot, because it's essential that we try to protect ourselves as much as possible. We don't want double whammy of flu and COVID circulating in the community. Wearing your mask, of course, is essential. And you've faced multiple respiratory viruses, you could be facing some significant challenges, health challenges, particularly if you have complications. What you see here are data that we compiled together with Cleveland Department of Public Health, showing our cases by zip code. And what we've seen over time is that more and more of these zip codes are seeing turning to darker green, where we're seeing higher rates of transmission in the community. Also, the zip codes vary in terms of their size by population, which can also have an indication of those rates, but those rates have been increasing over time. If we go to the next page, I'll hit some highlights on some of our trends, and Dr. Margolius can dig in deep, but basically I want to point you to just a couple things at the far right of the graph. You'll see the gray line and the blue line. They track data around the gray line is our critical care beds, basically people in intensive care units, and the adult medical beds. We've seen increases, 87% utilization of the ICU beds. More and more people are in the ICU dealing with COVID. And we've heard now statewide that 1 in 3 people in the ICU is there because of COVID. So, and here we are in December with January, the cold months of February ahead of us, even as we all look forward to the prospect of a very strong vaccine ahead. We have much to do to protect the most fragile of us. So the orange line shows our pediatric beds, and our ventilators are the yellow line. So we are concerned about this increase in the gray and blue lines, particularly as it'll affect our hospital systems, and I'll defer to Dr. Margolius on the details. If we go down the page a bit, we're moving toward the end of the brief here. We have 2 very important indicators. We track together all the data from the hospital systems on testing every week. And so if you look where we started at the beginning of November, you'll see we had about 14.9% of people tested positive. That's incredibly high. As you know, in the state here, we track the states where rates are above 15%, and we tell people not to travel to those states. In the county, we were at essentially 15% at the beginning of November. We're now at essentially 25%, 1 in 4 people tested in this county. And this is from all 3 hospital systems, 38,000 people, 1 in 4 were positive. That means that we all have to move about the community as if we are positive, or presume the people we are talking to are positive. I've got teenagers at home. If they're interacting outside of the house, they come home and I'm wearing a mask, and so are they if they're interacting with us. We have to be very careful because there's a lot of transmission where people don't have any symptoms or they're pre-symptomatic. Even more concerning too is if we look down at the nursing home testing from the Center for Medicare and Medicaid Services, we see this rate of 14% positivity in our nursing homes, our most fragile of our citizens. And that rate is up from 5% just in a matter of weeks. So the trends are very concerning, and they're moving in the wrong way. From a vaccination standpoint, we did hear we did hear about the priority groups that the governor described, and I think, Ann, there may be a graphic on that if you want to show it. If not, I can just walk through it, maybe easy enough. On one of the other attachments that I sent along that shows the state's priority groups in what they call phase 1A for vaccine distribution. So there's a glimmer. We're excited about the fact that we have multiple vaccines now that are effective. We have a Pfizer vaccine, we have a Moderna vaccine, and we know that there's an AstraZeneca vaccine, also a Johnson & Johnson vaccine off in the wings coming forward. And we're waiting on those final approvals from FDA to have this vaccine on the street and begin a vaccination process. People need to understand that this will take time. And we know that there is hesitancy. Thank you very much, Ann. You'll see on this graphic, there is hesitancy in a number of populations, understandably so, around vaccination. But people need to know that the FDA is thoroughly vetting these vaccines. We know recently the United Kingdom released the Pfizer vaccine through their mechanism for vaccination. We're looking at this vaccine today, and it's been tested on tens of thousands of people. And so it's important to know that in H1N1 10 years ago, the H1N1 influenza, we expedited a vaccine 10 years ago. It's happening again here. And so We need to recognize that there were lots of dollars thrown at this in order to get this moving through a process, but it's been thoroughly vetted through FDA's process of testing vaccines on multiple populations for side effects. So to date, there's no evidence of any severe side effects. You can have soreness at the vaccination site. You could have 1 or 2 days of flu-like symptoms. But we know that the vaccine is very effective, over 90% effective in every case on all the different companies. But we're going to be focusing first on this trickle of vaccine with healthcare workers and people involved in COVID care, and that makes sense. Also with residents and staff in nursing homes, residents and staff in assisted living facilities, and patients and staff in state psychiatric hospitals. Also, we'll be looking at people with intellectual disabilities and those with mental illness who live in group homes or centers, and staff at those locations, along with residents and staff at our Ohio vet homes and EMS responders. So vaccine will be provided through many skilled nursing facilities by CVS and Walgreens, working with them. The hospitals will be assisting their staff and on many cases, and perhaps other nursing home staff. Health departments will be working with EMS and some of the other community groups listed, but recognize that this is a prioritization process to get those most at risk first. And the vaccine will come out in waves over the course of the next 6 to 8 months. And we have to be patient and recognize that we want those folks most at risk to receive the vaccine first. But the first shipments are expected to begin to happen to hospital systems the middle of December. And then the following week, we would expect additional shipments where health departments may start to receive the vaccine. We've been working both with the Cleveland Department of Public Health and at the county to do drive-through flu vaccination clinics to practice to move this vaccine. And H1N1, 10 years ago, we had points of dispensing, or what we call pods, to dispense the vaccine, working with community volunteers. We work with a number of fire departments doing vaccinations so people drive into the firehouse where you have some protection from the wind, but lots of air circulation. And so we've practiced those, and we'll be working together very closely with EMS and other at-risk populations to start this process. The Pfizer vaccine is a 2-dose regimen, and so they need to be given several weeks apart, and we'll be tracking that process. And we'll see then the Moderna vaccine will be coming forward again, as I mentioned, in late December. But these details were just released generally by the governor on Friday. So we're still working on those details. So with that, Mr. Chairman, I will pass it back to you.
Thank you. Thank you, Commissioner. I appreciate that thorough overview. I want to jump back quickly to Director Kimball. The Commissioner touched a little bit on the contact tracing. Can you give us just a quick reminder of how that works? So if someone is presenting with symptoms of COVID-19 or is tested positive, what does that process look like to contact trace, and how does that work? Director.
Yeah, Mr. Chairman. So as we receive all positive cases that live in the city of Cleveland. It starts with us initiating a interview with the positive case. From that, we generate a list of their close contacts, those individuals that have been within 6 feet and unmasked for more than 15 minutes. Once we generate that list of close contacts, we then we reach out to them. Similar to as Commissioner Allen identified, we're working with the state Ohio Department of Health as well, and they're supporting our contact tracing efforts as well. So we generate a list, and that list is provided to them, and they're reaching out to those close contacts that we've identified. In some cases, we are able to do the contact tracing for our positive cases as well, but primarily they're giving us support around that.
Thank you, Director. And I've got a question to you. I know Councilman Harris has to jump off, but the question of being, are we working with additional organizations to help with contact tracing, or is this all done in-house, and how many folks are doing this work?
So to answer your question, We're doing it in-house as well as we've hired temporary staff to assist us. We are looking at establishing a contract with the outside agency to assist us in that, assist us with this as we work through this. But currently we have approximately, I would say in total, 60 individuals, both temporary staff and permanent staff that are assisting us with that. They're working 7 days per week. Now, not every city or Department of Public Health staff are working 7 days a week or assigned to this for the 40 hours a week. We are rotating staff based on operational need. So that we continue to address some of the required program deliverables that we have to meet.
Thank you, Director. Appreciate that update. Dr. Margolius, can you start us out, please? What are the symptoms that folks are commonly presented with COVID-19 as a reminder for folks watching or for the community? What are we seeing in the community?
Sure. Well, thank you so much for having me here, Councilperson McCormick. I really appreciate it. Honored to be in such great company with all of you today. So I am the director of the COVID hotline at Metro Health. And between March and the end of October, I spoke with, we ran the report, I spoke with 176 folks who were positive for COVID-19 during that time. And each week since then, I've spoken with about 100 new folks who are positive for COVID-19. So the rate right now is just astronomical, and we did not think that these numbers would ever come. So what I'm hearing when I speak to folks is many of them truly do have mild symptoms, and that's both good news and bad news, as Commissioner Allen alluded to. A lot of folks who I speak to are so shocked when I call them to let them know they're positive because they were convinced that this was their annual sinus infection or just a cold. And they've been going around, going to work, business as usual for them because they were this was allergies, the weather changed, I was out in the cold, and now I have these symptoms. So it's incredibly important that folks know and that we spread the word that the symptoms can be very mild. In fact, some people have no symptoms who test positive for COVID-19. And so the range is wide. And in the worst cases, they have high fevers, shortness of breath that can last for a couple of weeks. And just as Commissioner Allen alluded to, they need to come in to be seen so we can check their oxygen level. But in many cases, they only have mild symptoms.
Thank you. And Doctor, I'm going to ask you too about what you're seeing on the ground in Metro Health, but just another housekeeping item here. We're hearing a lot about the vaccine, which seems like great news, but can you tell us why is it still important that folks, keep social distance and wear masks and follow all those guidelines, even as the vaccine starts to roll out? Can you touch on that, please?
Sure. Yeah. So I think as Director and Commissioner alluded to, what we're facing right now is completely unprecedented, and the scale is just so much higher than it was when we faced this in March and April, and then July. You saw the y-axis on that run chart that Commissioner Allen showed. You can barely see the surge in July on that graph because we're so much higher at this point now. There was a point in July where I was working 20-hour days for 3 straight weeks, and we overcame that. But our highest case count in a single day then was 46 as a system. We diagnosed 46 cases in a day. On Friday, we diagnosed 266 cases in one day across our system. And so the reason this is so important right now is we can't function on the highest level if there are this many cases. We need to get the cases down again so that we can put all our resources into deploying this vaccine when it arrives.
Thank you, Doctor. The other thing that the commissioner noted too is the hospital capacity as well as the ICU Can you speak to, from your perspective at Metro Health, what you're hearing from your colleagues at the other hospital systems? How are hospitals faring right now, and what does that prognosis look like, in the next few weeks?
So we're concerned. There are two things that are going on. So number one, looking backwards, our highest hospitalization count at any given point prior to November 1st was 33 at Metro Health. Today, we're at about 70. And so on the one hand, we have all these patients that we didn't have before, but on the other hand, and just as concerning is we've got staff, we've got doctors, the personnel throughout the system who, because of the high rate in the community right now, are appropriately calling off sick from work. And so we're up patients and down staff. And that's the experience at Cleveland Clinic and University Hospital as well, from what I'm hearing from them.
Thank you. And before we open it up to our colleagues here, what else, Dr. Margolius, would you like to share with the group in your opening remarks?
So thank you. I think the two trends that I really wanted to point out that I'm hearing on the phone from patients that I speak with are, number one, the mild symptoms. I think everybody should know that, this is not your sinus infection this year. This is not your allergies. This is COVID. And you need to act like it. Number two is when people call the hotline with symptoms, they are at work. Often they are at work. And the reason they are at work is because their employers won't let them off work unless they have a positive test. Right? And so they've got symptoms, they've got an exposure, they're worried, but they are still at work because they don't have the sick time. They're worried about losing their job. Small businesses are worried about shutting down. In many cases, they work for businesses that aren't headquartered locally. And so they've got policies where, just walk in and get a test and come out with the answer in a couple hours. And that's just not the case on the local scene. That might be the case in other cities in the country right now, but it's not here. And so folks are at work with symptoms, and that's especially concerning to me. So anything we can do to kind of figure out how to help alleviate that situation will go far as well.
Thank you. Before we open it up, I know we've got Chief Walker Minor and Chief Martin Thompson on the call as well. Just like to provide them the opportunity if they'd like to make any opening remarks as well. If not, we can move on, but I just wanted to give that floor. Chief Walker Minor, I'm seeing you unmute.
Oh, I'm deferring to Chief Martin Thompson.
Okay. Just don't want to leave anybody out here.
Sure, thank you.
All right. Okay, well, I think we're going to open it up to our colleagues here today. And again, I want to thank those who are folks who have presented here today from the city, county, as well as Metro Health. I've got a question from Ward 12 Councilman Anthony Brancatelli.
Thank you, Mr. Chairman, and certainly thank you to all our guests and helping us work our way through this really struggling pandemic to get to the end. One of the questions I would have is how do we work together to make sure folks know that you can get testing? There's a lot of opportunities for testing. I know places like Elizabeth Baptist Church is offering some free testing, and you don't have to have symptoms. You don't have to be referred by a doctor. I think one of the concerns are early on, folks were told, well, if you don't get referred, if you don't get, if you don't have real direct symptoms and or more severe symptoms, you can't get tested. Where is testing readily available, and how do we continue to direct our residents to these locations? Where can we direct them to say, where can you find out where you can go to get a test as quickly as possible?
Would you, Mr. Chairman, would you like me to respond to the Councilman? This is Terry Allen.
Yep, go ahead, Commissioner. Thank you.
Thank you, Mr. Chairman. Councilman, thanks for your question. So yes, I think we look back to where we were in the spring. As you recall, there was essentially no testing available in the community. We've come a long way from that standpoint. And actually, there's a lot of testing that's widely available in the community. Right now, we've had a lot of increased interest, understandably, in testing because of the surge. But there are locations that we've collaborated together with Cleveland Department of Public Health and Metro Health. There are locations that have been established really since May, testing locations connected to the greater Cleveland congregations, to a range of community locations, as well as service for the homeless populations, a number of other adult care homes, places where we've had clusters of cases where we can respond. There are testing locations at all the pharmacies, as you know. The hospital systems are testing their patients through referrals. The federally qualified health centers have come together and are doing testing, and many have expanded the ages to test at every age range. And in most cases, many cases, I should say, you actually don't have to have symptoms. So we've seen an explosion of that, the testing capacities throughout the community. We do have a link on our website. If you were to Google CCB as in boy, HCCBH community testing sites, you'll get a link to all kinds of places where you can, all those places I listed are there. You can, I can also send that to Ann as well if you want to push that out. I think we need to push that out through social media sites, into the community through briefs everywhere, so people recognize those places are available. I will tell you that because of the demand, there have been some delays in getting an appointment sometimes. And also then because of the demand, there's a bit of delay in getting those results. But Dr. Margolius said something that's really important. We've been finding more people coming to us with their results. And when we do the interviews, they're telling us that, well, I was sick for a few days. I just thought it was a cold. And so I waited. And Dr. Margolius was clear. It's COVID this year. Don't wait. If you have symptoms, go and get tested and stay home, stay home, stay home. I think those are the big messages that we want to share.
Thank you, Commissioner. And certainly, as Dr. Margolius referred, people are calling from work when they have the symptoms. And I think that's a hurdle that many of us have to work with our businesses to overcome, especially those in the service industry, where taking off work really isn't an option sometimes. And being able to get access to unemployment benefits. We've seen unemployment benefits being clawed back because there's this dispute between the employer and the worker. So we have to get over that hurdle of telling folks, yes, you need to come in and get tested, and yes, you need to take work off, and then try and work through the unemployment system to make sure folks can still pay their bills. But that stigma of some folks getting tested positive, they're concerned about it. So folks going to work sick, which we're now learning, we got to keep emphasizing, don't go to work sick, whether it's a flu or not. So I don't know, Doctor, if you want to add to that and how we can get past some of those stigmas.
Dr. Margolius.
Yeah, no, thank you for bringing that up. The stigma is a huge issue. When I speak to people on the phone, you can hear them kind of processing. The first, it's their health, but then who else did I possibly expose? And then what will everybody think of me? So you're absolutely right. We need to get over the stigma. We need, as much as possible, people who are positive to feel comfortable sharing that they're positive and setting that model just to show we don't want people to necessarily blame themselves. I mean, this is so hard right now. It's so prevalent. I would guess that right now, 1 in 30 people in our community have it, based on our numbers. And the other thing regarding testing capacity. So I'm thank you, Commissioner Allen, for mentioning our partnership. In partnership with the Cuyahoga County Board of Health, we've done over 14,000 tests in under-resourced communities and congregate living facilities such as shelters, group homes. But one area where we are struggling is if someone calls us, one of the doctors on the hotlines, and they say, well, I'm asymptomatic, but I think I had an exposure and my boss says I can't come back to work until I have a negative test. On the hotline, that's not a test that we're able to do at this time. And the reason is because of our overall supply. If someone gets a test and they're negative, and then 4 days later they develop symptoms, that's also when they need the test, and we end up doing 2 instead of 1. And so it is a really difficult situation. The solution being that anybody should assume that they are positive, regardless of their exposures, and wear a mask at all times when they are with others who don't live in their home.
Thank you, Councilman.
Thank you, Mr. Chairman. I also want to thank Doctor for serving on the board of University Settlement. These local settlement houses and nonprofits are essential to being able to get to our residents, and we rely on volunteers and those who are helping us. So thank you, Mr. Chairman.
Thank you, Councilman. Appreciate that. Again, a reminder, if you'd like to ask a question, please use the raise your hand function. I don't see any other members with their hand raised at this time. Before we move on,
Councilwoman Santana is trying to.
Oh, she does. Okay, go ahead, Councilwoman.
I'm trying to figure it out. Okay, thank you. Could you hear me? We're good?
Yep, good to go. Thank you.
First of all, congratulations, Councilman McCormick, on your appointment. I look forward to serving your leadership. You're doing a great job. So through the chair, and I think this is more for Dr. Is it Magnolia? I'm sorry if I, Dr. Margolius. Okay. So can you have symptoms and test negative to COVID?
Yes, I'm so glad you asked that. The test is about 70 to 80% sensitive. So if you have COVID, you have about a 1 in 5 chance of having a negative test. And so going back to, if you have symptoms, act like you have COVID, stay at home, quarantine, wear a mask, at least until you feel better, even with that negative test.
And so another question is, if you have the symptoms, but you don't get tested and you call the hospital, are those numbers being considered as part of as positive without even taking the test?
No, they're not. So often we will talk to a household of 5 or 6 folks, and if 2 or 3 people in the house already have a positive diagnosis of COVID, and the other 3 have symptoms but don't yet have a test, we will say, you know what, you don't need to put yourself through the test. You can assume that you're positive, and those numbers will not be reflected in our totals. So as from the beginning, the count is always an undercount.
Got it. Okay, thank you. And so my next question through the chair is for Commissioner Kimball. I had several family members that tested positive, and I would say that the city tracking team, they're phenomenal. They're very empathetic. They called right away. So I had to do the interview for these family members because they didn't speak Spanish, and I'm just wondering if there's any plans to hire Spanish-speaking COVID tracers, or if you have them already in place.
Well, we are looking, searching for that. We are providing training to one of our employees who's fluent in Spanish to help support that. We recognize that has been a challenge internally. So we have identified that, and we're looking to correct that.
Got it. So then we can't really get an accurate count of how many Latinos were diagnosed if the tracers are not really communicating with the Latino community, correct?
I would say no. We're using a service to provide translation when need be. So we are collecting that data, and we can identify that.
I know they did ask, if I was or if this person was Hispanic, and I know it captured that, but what I'm worried about is, like, if you reach out, they don't understand your language. They're just hanging up on this tracer, right? So they're not, the city's not collecting data. And I know that the count for the Latino, the percentage is that is stated, does not really represent how many Latinos are being impacted by COVID. So I don't know, what's the gap there? And I'm not sure, like, even with the hospital, like, I don't understand why we're at a place still where we're not collecting, race and ethnicity correctly. So I just kind of want to put it out there that I don't believe the numbers are accurate. And so I don't even know, as the body or as the city, even working with the hospitals, what could we do to get a better count on races and ethnicities that are being impacted?
Director?
So The information, race and ethnicity is collected. It's collected at the test site, and we track that. As far as once we're contacting individuals, we're contacting because they're already positive. So we are collecting and documenting that information. It's documented. It's just that we have to improve on the contact tracing once we get those positive cases.
Got it. And then my last question through the chair, to Commissioner, do we know the areas of the cities that are being impacted the most by COVID-19? I'm not sure if you guys mentioned that, and I'm sorry if I am repeating, I just missed it. Just maybe not wards, but just areas that, we could be more mindful of the businesses and, the bars and the activity that's happening in those areas.
Right, we do. We've worked with the county and to generate maps to identify zip codes where we've seen an increase in positive cases.
Got it. Okay. Was that map shared? I'm sorry, because I missed that.
That was, yes.
It was? Okay. Through the chair, can the PowerPoint be emailed to us?
Yes, absolutely. And can you make sure that all materials today are sent out to the committee and all of council?
Okay, I'm done. Thank you.
Thank you, Councilman. Appreciate that line of questioning. I've got Councilman Charles Slife. Go ahead, Councilman.
Thank you, Mr. Chair. Congratulations on your chairmanship.
Thank you.
Just a couple quick questions from my end. The first would be, and I apologize, I did have to step away for a second, but I don't believe I'm repeating anything. It was just mentioned that the tests are, there's about a 20% false negative. What test is that? Is that the PCR test or the rapid test? Because I've heard that there's different rates for different tests.
Correct. Yeah, that is thank you for the question. So that is the PCR test. Folks remember early on, the rapid tests were somewhat unreliable. Famously, Governor DeWine's test that was a false positive before a true negative. I will say that the rapid test technology has gotten much better since then. And so I'm hopeful that going forward, that will be one more tool that we can use to help flatten the curve over the next 3 to 6 months until we get to the place where folks have been vaccinated. But yeah, that is the PCR test, which is a nasopharyngeal test, which hurts.
Thank you, Doctor. Go ahead, Councilman.
Through the chair to Dr. Margolius, do you have a rough accuracy rate of what the rapid test is currently at?
Yeah, so it completely depends on the platform. There are a couple from one vendor now that are nearly as accurate as the PCR test. So that's the Abbott platform. There's a test called the Binax now, which is nearly as accurate as the PCR test. Okay. And you get a result within 15 minutes. It's pretty incredible.
Through the chair to the directors, I'm personally worried about a lot of our healthcare workers. Clearly, there's a lot of healthcare workers who are getting sick, who are not able to be in the hospitals to take care of patients. And I'm curious, to what degree do the two departments coordinate with our area hospitals to make sure that they are testing their employees and maintaining the safety of their employees?
Mr.
How is that
Chairman,
regulated? What are the standards?
Mr. Chairman, Councilman, so we talked to our hospitals. Both Director Kimball and I are on the phone every week, oftentimes multiple times a week with all the hospital systems. And we work hand in glove during emergencies and all the time with the hospital systems. And so we know that there's quite a bit of testing going on in the hospital systems. And I think maybe the best way to describe that process is probably Dr. Margolius describing what happens if you've got a symptomatic staffer, to describe how that process works. That might be the best way to approach this.
Doctor?
Sure, yeah, no, and thank you for looking out for us. So through our 24/7 hotline, if an employee has symptoms, even mild symptoms, they call us, they schedule the test. It's done within 24 hours, and the result shows up in their My Chart within about 12 hours from that. And so we are keeping our staff protected. What has happened in the last few weeks, as we've mentioned, has been unprecedented and quite scary, just given the number of employees who have been positive. We think that is through community spread, but people can't have lunch, at the same time anymore, even if they're on the other side of a small room. I mean, it's just gotten that bad, that it's going to be a tough month or two or more.
Thank you, Mr. Chair. I'll admit, and this is maybe anecdotal, but I do have some concerns that there's different standards between different hospitals for how they are testing employees. I can tell you, my wife works in healthcare at a hospital locally. There's not a 24/7 availability of employee health, as opposed to a friend who works at a hospital that you had to pass 2 rapid tests in order to return to work. Others are, you have to only pass it once, even if you're still exhibiting pretty strong symptoms, you're told to report. So I worry about how frontline institutions, maybe some are doing it right, but others maybe need to be pushed a little further. I have concerns that a friend of mine who works in public safety, not in Cleveland, was told to report to work as a fireman when he had a pending test. So I very much worry about really the desperation of many of our hospitals and public safety outfits who need the workers, but could potentially be exacerbating the spread of the illness themselves. As to the degree that we're able to regulate our hospitals and make sure that they're adhering to best practices, I believe that's incredibly important. To Director Kimball, when it comes to contact tracing, I'm wondering if there's any ability to use texting.
Director?
To the chair, to the councilman, could you repeat that again? I'm sorry.
If I say that I tested positive, and instead of giving if I were to give phone numbers instead of calling, would you be able to do a mass text? Would that allow the information to get out more efficiently to a wider audience?
Currently, we're not using text. We do email correspondence back and forth. We have that information. So I know the other health departments do use that, but currently we're not. We don't have the infrastructure to do that at this point. All
right. Mr. Chair, I know that there's a lot of texting services out there, and I think that that's something that perhaps the department should explore. My son's babysitter tested positive, and we never received any call from any sort of contact tracer. Now, he's a child, so maybe they tried to contact him directly. But I want to make sure it was said at the top of the meeting that we're having to triage our contact tracing and focus in kind of more vulnerable groups. And if there's an ability to cast a wider net through texting, I think that that's something that we should, it's important that we explore given the numbers. But with that, I'll yield my time.
Thank you, Councilman. And, Director, I think that's a great point by the Councilman. So if we could take a look at what other places have done regarding the texting interface for contact tracing, we'd appreciate that. Okay, I've got Ward 9 Councilman Conwell. Go ahead, Councilman.
Thank you very much. This is to the chair, and congratulations, young man. I know you'll do a great job and pushing this, and you'll get in the middle of it and to help out. So congratulations.
Thank you, Councilman.
Congratulations from the wife also to
Thank you.
To the chair, to the director, what kind of structure or systems that, and I'll help you, that we can put in place to reach out to the African-American community as well as the Latino community. They're afraid of this shot here. They're afraid of the system, but we got to have us involved because we're part of the paradigm. And let me say this before you answer the question: some cities have put together groups or a working group to reach out to the African American community as well as Latino communities to deal with the shot. And I yield. Director Kimball.
Through the chair to the councilman. Yes, we are developing a communications plan. We are, Ohio Department of Health is putting together a plan as well. So collectively, we will put together a plan to reach the African American community and the Latino community. We have been in the community with our minority health and community health workers, walking and talking with families and residents. Excuse me. We know we have to increase that. We have to create a positive message around the vaccine, and we intend to do that. And I welcome your assistance and anyone else's assistance to develop that plan.
You know, Vicki Johnson from Cleveland Clinic reached out to me a month ago, and she asked this question: would I take the shot? You know, being a cancer survivor, and you know, and I'm in leadership in the African American community, and you know, I told her I had to talk with the boss, the wife, and we decided that I would take the shot for the trial basis. You know, you do a random sampling to try to see what are the side effects with African Americans before the shot is given out to African Americans or as well as Latinos. So I said, okay, I'll be in that group. Channel 19 announced that I was going to take the shot. Okay, so then the feedback I get, people calling me on the telephone saying, "Hey, councilman, you crazy. Hey, councilman, remember the Tuskegee Institute? Hey, councilman, I don't trust them." Even, director, my father called me from Birmingham, Alabama, and said, "Son, you crazy. Don't trust those people. They're trying to kill us. Son, I'm not taking that stuff. Son, you crazy." He even called my brother in Los Angeles and said, "Your brother has lost his mind." So it's the feedback that I get from the community, the feedback that my father even called me from Birmingham, Alabama. They're afraid. And rightfully so. As you know, the system have, you know, Tuskegee Institute, and they can point to incidents that we've been used as guinea pigs. People are afraid. But we got to show leadership, and we have to, because if we don't take the shot or whatever, that it will hurt. And let me give you this other piece. I went to this store in my neighborhood, and they're like, "Councilman, if you take the shot, the people that take the shot, they're gonna, when they turn on the G5, some kind of 5, you're gonna explode, Councilman. You're gonna blow up." You know, so all these fears that's out there, we got to get ahead of it. We have to show leadership, put together a group, and they're doing it, Director. In some cities, like I think Denver, New York, other cities, they have African-American pastors, African-American political figures, African-American leaders, or who are in line to take the shot to show that that it's okay. Although in my neighborhood, they say, "Councilman, you can take the shot," but we still ain't taking it, you know, but we got to get in front of that. I mean, that stuff is real. By Channel 19 announcing it, Director, it's a case study. It gave me an up-close view of what the residents were thinking. Even my dad called me from Birmingham, Alabama, and said, "Do not get on that trial, son. You know, don't do it." But I got to show leadership, and I'm big on leadership. You got to walk it like you talk it, or you lose that beat. That means a lot to me in leadership. And I yield to you, Director, to the chair.
Thank you, Councilman. Director.
Yes, to the councilman, I agree with you 100%. I've heard those comments as well. There are a lot of folks out there that are hesitant and frankly scared to take that. I think we rely on the scientists. We rely on all the research that's been put into this, and we have to communicate that in a way that resonates with our community. So yes, we will work diligently to change that message to our community.
You know,
Thank you, Director.
here's
And I would just ask that you make sure that Councilman Conwell and anyone else on council is a part of that, developing that plan as well. Go ahead, Councilman.
thank you, Chair. So, Director, if you take the shot, here's some questions. How long will it protect you? I mean, they say it's 90% or 95% effective, but effective and efficiency are not really interchangeable. So let's say you take the shot, are you protected for how long? Is it 3 months? Is it 6 months? Is it forever? Or you got to take it annually like the flu shot? They're not telling you that, and I yield for that question.
Through the chair to the councilman, I don't know if doctor could speak to that. I would appreciate it.
Dr. Margolis?
Yeah, sure. No, it's a really important question. What does it mean to be 95% effective? So I'll speak to one of the trials. So in that trial, they enrolled tens of thousands of people. Half the people got a placebo, so it was just like salt water that got injected, and half the people got the vaccine, and they didn't know who was who. 3 or 4 months later, about 300 people had gotten COVID-19. 95% of those people were in the placebo arm. So 285 or something like that were in the placebo arm. 15 people got it who were in the vaccine arm. And so that's where that 95% comes from. Most of the people by far who got COVID-19 were in that placebo arm and not in the vaccine arm. Furthermore, I think there were about a dozen people who got really sick from COVID-19 during that time. All of the people who got really sick from COVID-19 during that time, so who were in the hospital, et cetera, were in the placebo arm. So that's the type of data that they're looking at in these vaccine trials, and it's honestly incredible. I too, a friend of mine asked to be in the vaccine trial back in June or July. I was like, are you crazy? You know, right now with everything, all the, you know, going on with federal government, et cetera. And she did it. And after she got her booster shot, she had 24 hours of kind of low grade symptoms and flu-like illness. And she was incredibly happy that that happened, because that meant she probably got the vaccine and not the placebo. And then last month, when the Pfizer data got released and she had gotten that Pfizer vaccine, she was laughing at me. So I completely agree with the reluctance, and I think all hands on deck to help spread the message and get us out of this.
Thank you, Doctor. Go ahead, Councilman.
Let me ask you this. We don't know how long it will last. That's something we don't know. We have to quantify that. Here's the other thing. What are the odds that it will mutate? That's number one. Change up on us, because we don't know. That's the other unknown. There's a lot of known unknowns, Doctor. Would you agree? There's a lot of known unknowns. And here's another unknown. If I take the shot, the virus shot, and let's say it protects me, and we don't know how long it will protect me, but while it is protecting me, can I be asymptomatic? You know, I'm protected, but can I become a carrier, although I am protected? So that's another unknown. So I yield to that question also.
Thank you. Dr. Margolis, please.
Yeah, thank you. And you asked that earlier. I'm sorry, I missed that. So in terms of the length of protection, the type of immune response that we have seen looks like the same type of immune response that we get when someone is protected for years. And so
years,
we don't
like
know.
3 years, 4 years, what?
17 years is what one study showed. And the reason I say 17 years is because that's how long it's been since SARS-CoV-1, the first SARS virus.
Okay.
And so if it's that same type of immunity as folks who had SARS-CoV-1 get with this one, it's at least 17 years of immunity. So we're really excited from what we've seen so far, promising T cell immunity that really runs deep in the system.
Yeah.
So
What do you think about a mutate, that it might mutate on us, something like that? Because you got to look at risk. You look at risk, and you guys do risk analysis. So what are the odds of the mutation? I'm listening.
Yeah, no, and I'll get to your asymptomatic question as well, because that's a great question. So mutation, scary, possible. I think the promising thing from generally when a virus mutates in this type of circumstance is it becomes less virulent, which means it causes less disease. So if the virus were to mutate, hopefully that would mean it would become less powerful. So maybe it would mutate to be able to spread more, but hopefully would become less deadly, in other words. So mutation we'd be okay with. The vaccine directs your immune system towards an important part of the virus that will continue to be important even if it were to mutate. And so I think we're good from that perspective. As far as your question about asymptomatic infections, so the data, the full data for these vaccine trials has yet to be released. So we're going to learn a lot more this week and the following week. But it sounds like that they were not routinely swabbing people during the trial. So it was more if they got symptoms, they got tested. But it doesn't seem like they were routinely swabbing people to see if they were carrying asymptomatic infection after they got the vaccine. And so we don't know yet. We will learn a ton in the coming months as we have. But that is one possibility, is that once someone's vaccinated, it's possible that they could still carry asymptomatically the infection for a few days. And so even when some people get vaccinated, they will still need to wear a mask and they will still need to be extra careful when they're around others. Yep.
You know, I look at odds and probabilities. You have to look at stats. What are the odds? You take this shot, like you're talking about probability and odds now. So what are the odds that you could be asymptomatic? You might be protected, but you could be a carrier. So you got to look at odds also. Though, I mean, I'm not a doctor, but I love stats and I think about that. Let me say this and then I'll yield. I'm there 100%. You know, I walk my neighborhood. I was out all weekend passing out flyers about lead and lead paint and who to reach, and I'll get it out there. But I think a sense of urgency, and especially in the African-American and Latino community, and don't leave out the Arabic community also, because they surrounded me when I went to a store and they were talking with me about the G something. What is that? The G, when they turn this G on, and if you take the vaccine. So there's a lot of fears. There's a lot of fears out there. I think that you get people in leadership and you meet with us and how we're going to have a plan to talk with key stakeholders and partners and how we're going to be able to talk with the community. I think that's super, super important. That's super, super important. And I think that, Chair, we're missing on this as well. We say wear a mask. We say wash your hands. I think what would be nice is if one of the experts like you was to put out what you would do, how you're doing prevention. And I think the name of the group, I think the name of that expert is I can't pronounce the word. We hired them in epidemiologists, something like the study of diseases. What would you do to do prevention to let people know? You know, it's like a Dr. Fauci saying, this is how I would do prevention. And then we get it out into the community, because prevention is the key. Although you can't measure prevention, but it can make things go down. That's just where I'm at. I'm not you, but I watch things. Thank you,
Councilman. And I think having a column from Dr. Margolius in all of our newsletters would be a wonderful idea. So we'll offer him up for that. Thank you, Councilman, and again to the director. You know, as you move forward with your plan to reach out to different folks in our community, please keep Councilman Conwell, myself, and others involved in that process so we can assist with that. And then the other piece of feedback was the ensuring that we have Spanish-speaking contact tracers, obviously a very important part of this conversation. I don't see any other hands of council members unless I am missing any. What I'd like to do at this time is ask our panelists for section 1 of this hearing to give us any last bits of thoughts, advice, or feedback before we transition on to the second part of this hearing today. So let me start with Director Kimball. What is your parting words of wisdom for us?
Be vigilant. we're not through this yet. Think of everyone that you come in contact as being positive. Protect yourself and you'll protect others. Remember, the person across from you could be your grandmother, your mother, your aunt, someone that you love. So treat that person with that same respect, the same protection that you would your loved ones.
Thank you, Director. Commissioner.
I think Director Kimball said it right. I really can't add anything to that. I will only say that people need to remember this virus doesn't have a conscience. You know, it will keep going until most of us are exposed or vaccinated. And that's just the way this is going to work. And so people, Director Kimball's vigilance and notes, it could be your family member, it could be somebody you love. We got a few more months. Hang in there, folks, and stay vigilant.
Thank you, Commissioner. All right, Doctor, round us off here, please.
Well, yeah, no, I think the Director and Commissioner said it perfectly. I would just add that I am so proud to be a Clevelander and a resident of Cuyahoga County. The way that everybody has come together to work through this has been incredibly inspiring. And this is our fourth quarter, our last inning, our overtime, whatever sports analogy you want to use. And so everything that we've been saving to get this right, now is the time to use it. All that energy to help others, help themselves, and support our community to get through this next few months so that we can be okay on the other end.
Thank you very much. And again, I want to publicly thank the three of you. I'm sure you're not getting a lot of sleep these days. So thank you for the sacrifices that you're making, and you know with your families as well during this tough time. So you are all welcome to either leave us or stay on for the next conversation. That's totally up to you. So and again, thank you for that very informative session. So our next part of our hearing today is going to be around the cold weather plan, specifically around our unsheltered population here in the city of Cleveland. This is, again, a topic that colleagues on city council as well as community members have really been looking to get an update on and a briefing on. So we're going to jump into that now. As a part of the hearing today, I have Chief Natoya Walker-Minor of the city of Cleveland. I've got Melissa Cirac with the Cuyahoga County Office of Homeless Services, Chris Nestrick he's the Executive Director of the Northeast Ohio Coalition for the Homeless, and Michael Searing, who's the Vice President of Housing and Shelter at Lutheran Metropolitan Ministries. So thank you all for joining us today. Chief Walker-Minor, can I have you kick it off, please? Would love to just hear from your perspective. You have been an advocate in the space of those who are experiencing homelessness, and would love to hear from your perspective from the mayor's office, how we are working together to address the cold weather plan this winter. Chief?
Thank you. Am I muted?
We got you. Go ahead.
Really?
I'm sorry, Chief. I think you're muted now. Let's see. Zakita, can we unmute Chief Walker-Minor? Or
she's unmuted.
Thank you. Can you hear me?
Yes, now we can.
Thank you.
Muted yourself again.
I'm not touching it. I'm not sure.
All right, Chief, go ahead. We're going to hope that it stays unmuted. Go ahead.
Okay. I am really glad to be here in what may be our first time in a proactive measure on our winter seasonal planning. What you have here, what you've assembled for this session today, are really the rock stars that really make it happen for us. And before I go on, I really want to formally introduce Melissa Cirac. Melissa, many of us know her. She's been working with us over the last year. She has come in and she was trained under Ruth Gillette, longtime champion shero for homelessness and improving the homeless continuum for about 25 years. Melissa joins us, and she came on board with a track record and a strong reputation herself, but she brings a burst of energy and has worked well with us. And so Ruth formally retired in December. So I formally want to just introduce introduce Melissa in her former role. She's amazing. Michael and Christopher, you all know they've worked well with us over the years. Mike and I have been together toe to toe on a number of things, and Chris has been in the ranks with us over the last few years when he succeeded Brian. For the winter coordination planning, there have been lots of plans that we've been working on together, all four of us and some of us in isolation. These are the same people that when COVID hit, we came together and we wanted to talk about what was the strategy so that we can protect that vulnerable population as well. So you will hear from Melissa, Michael, and Christopher on those items that include temporary porta potties, the locations, discussions around permanent restrooms, what that looks like, but also the strategies that we have put in place by way of contract for our winter seasonal planning. At this time, I'll turn it over to Melissa, Michael, and Christopher, and then I will jump in where I need to be. The reason why I'm turning it over to them is because they can give you more of the detail around that, but we have moved diligently to protect this vulnerable population, including contracts with some of the local hotels that have been partners to us. And what I will say is really not only for us a place of shelter, but really economic development for them, because but for these contracts, many of the rooms in these hotels would not have been occupied and those hotels would have lost dollars. So it's been a win-win for our citizens, for our hotels, and for our community.
Thank you, Chief Walker Minor. And again, thank you for your steadfast commitment for the our community members who are facing homelessness. Really appreciate it. You're always at the table and a leading voice. So thank you so much. With that, Melissa, would you please kick us off? Introduce yourself. Welcome to the table. We're excited to have you, and go ahead.
Thank you. Can everyone hear me okay? Fabulous. Good morning, everyone. Again, I'm Melissa Cirac. I'm with the Office of Homeless Services. Chief Walker Minor, thank you very much for your kind words. It's been a pleasure working with you. Councilman McCormick, congratulations. Well deserved. Thank you for the opportunity to share the work that the Homeless Continuum of Care has done in response to COVID over the last 10 months, and in planning for the seasonal overnight shelter during COVID as well. I truly appreciate the support from the city of Cleveland during these times. It has had tremendous impact, and I'm especially also grateful to be blessed to have such a strong continuum of care, which I already knew was strong coming into my work at OHS. But truly, this time has been challenging, and it's proven to lead the providers to be creative, committed, and nimble as we work through this together. So two of those providers, as Chairman McCormick mentioned, are on the call today from NEOC and Lutheran Metropolitan Ministry. And there are two of the providers that I've worked most closely with during these times, and I'm greatly appreciative of them. So they'll be joining me as we kind of walk through painting a very quick picture for you as to what our COVID response has been, because it's all interrelated. And then, of course, leading to what led to our COVID seasonal overnight shelter plan for 2020. So, Anne, I don't know, should I pull it up on my screen, or are you able to pull up the PowerPoint if you don't mind?
Whatever's easier for you, I can make you a co-host. You can share your screen.
I'm not very good at hosting anything technologically. So if you're able to, I know my strengths. If you're able to help, I appreciate it. Thank you so much. So as I mentioned, it's been a struggling year for us all as we work through COVID and our cold weather plan. So first, moving to slide 2, please. Thank you. Coming in March when this all started, some of our immediate actions, always working under CDC guidelines, as well as guidelines and recommendations from the Department of Housing and Urban Development were of course first to increase sanitation at all of our sites, and that's for congregate and non-congregate settings. Making sure, thanks to Cuyahoga County and other various donations, that we have the PPE available to those working on our front lines and with the homeless. And then putting signage up around the building, wash your hands, stay socially distant, and really pushing that out in the most immediate facets. In addition to that, recognizing the unsheltered population, NEOC really spearheaded increased outreach to those that currently were unsheltered at that time in March, and making sure they had access to hygiene items if needed, strongly encouraging flu vaccination at that point in March if they had not received it. And then, of course, if they were symptomatic, ensuring that they were able to get tested or isolated if needed. Along with that, we looked at our congregate settings and the homeless system, and we first tried to divert individuals who were currently from shelter. So for individuals that were in shelter, we used a variety of resources to pay for gift cards that could either offer food assistance or additional support to families. So at the shelters, they would have those conversations with residents saying, if you have somewhere else where you could potentially stay, at this point, that might actually be more beneficial for you as opposed to this large congregate setting. So gift cards were used in order for those individuals, if they had an aunt, for instance, that they could stay with, they could take that gift card with them and provide that level of support if they had someone else that they could, remain with. We also did use this diversion method on the front end of our shelter system. So we were challenged to deconcentrate our current congregate settings, but also, of course, control the influx that could be potentially coming into our system. So that diversion assistance was also offered on the front end, hopefully lowering the amount of individuals that need to enter our system. Moving on, please. Thank you. So part of that deconcentration involved using alternative shelter arrangements. And in this case, for our community, it was several hotels. And initially we focused, of course, on single men and women. Again, those are our congregate settings. Our family shelters are set up more in a way where it's more easily for them to isolate if needed. We focused on serving those that were unsheltered as well, transitioning them into hotels. And then we worked closely. We've had a great partnership throughout these last 10 months with the Metro Health team. And prior to testing being available, we started conversations with them on how do we screen for COVID at our shelters and what does that look like. So along with starting this deconcentration, each shelter began doing their screening, asking the basic questions, doing temperature checks, do you have a fever, do you have a cough? And from there, if those individuals were symptomatic, they would be transitioned into the hotels. In addition to that, if individuals had pre-existing conditions and were found to be some of the most vulnerable in our congregate settings, they were also able to utilize the hotels. And again, we developed this plan in conjunction with Metro Health. Moving forward, our partnerships in this hotel deconcentration effort have largely been those that are listed here. Lutheran Metropolitan Ministry, I cannot express enough, has served as the conduit for the hotels. And that means through the logistics, the operations, the food, and also financial piece. So they really have been a steadfast partner in this. In addition, the YWCA that operates Norma Her was part of the deconcentration efforts, having a congregate setting. Northeast Ohio Coalition for the Homeless, Chris, has been critical through this whole engagement in helping connect the unsheltered into our system appropriately and ensuring that we're engaging with them as appropriately based on that subpopulation. And then lastly, as I mentioned, Metro Health, which has worked with us on those alternative locations and shelter prioritization. So the variety of hotels that we have used over time, which has varied from 3 to 4 spaces, has been very graciously funded through Cuyahoga County CARES Treasury funds, the City of Cleveland CARES CDBG and ESG funds, Cuyahoga County CARES ESG funds, the Greater Cleveland COVID Relief Fund, and the Ohio Development Service Agency CARES and ESG dollars. Moving on, thank you. So as testing became available, we started that in May. And Metro has been great. They originally reached out to us and said, what can we do as the hospitals engage individuals that test positive for COVID and are found to be homeless? And working in that collaboration, other hospitals then became involved, Cleveland Clinic and University, St. V's, to talk about what does that look like and can there be a space for individuals to quarantine. Similarly, as we began to roll out testing in our shelters, we had the question of what do we do with an individual who tests positive for COVID and is currently in our shelter? So thus came the hotel that we currently have for those that are COVID positive, either coming from a discharge from the hospital as homeless or being tested within our shelter space and found to be positive. And the partners are listed there, Cuyahoga County Board of Health, of course, all of the COC providers, the Visiting Nurses Association in this initiative provides the medical piece. So we have the facility, one site designated for those that are COVID positive. Frontline Services handles the referrals. So anytime the hospital has a discharge for someone that is homeless, or anytime the shelter has someone that tests positive in the testing rounds, they funnel that referral through Frontline Service, similar to our shelter system itself, where anyone seeking shelter goes through Frontline. From there, Frontline Services works with the Visiting Nurses Association, who provides the medical ongoing service on site at the hotel. And then in addition to that, Lutheran Metropolitan Ministry, as I mentioned, handles the funding for the hotel, as well as the security and the food and those logistics. So as you can see, it's taken very strong partnership working across the system. The COVID positive hotel to date has been funded by Cuyahoga County and currently has the capacity for 35 rooms. Looking just at a quick mention of how testing has gone for us, you know, the providers I owe a great deal of gratitude to and believe that overall our testing percentage has remained low. Up until most recent, it's been below 4% since we started testing in May. And I really attribute to that, to their quick reaction, their ability to maintain the sites, you know, in regards to sanitation and clients really following through on wearing masks and following the protocols. Most recently, we have had some testing sites that have gone upwards to what we're seeing in the community, which is about 15%. So similar to the healthcare system and just the community and all of us in general who have COVID fatigue, these are posing to be some challenging times. So when we talk about being in the last quarter, we're all tired, but we recognize that at this point, we're taking a look at the resources that we currently have and saying, as we move through the next 3 months that are supposed to be the most trying, how do we provide the best for our community at this point? But testing is happening regularly to the Congregate sites, along with flu vaccinations at this point, and that's greatly due to our partnership with Metro Health. Moving forward. Thank you. Some of the additional initiatives and responses that have come out of our COVID plan has been the Sanitation Stations. This has been a great partnership, truly, with the City of Cleveland, Cuyahoga County, Ohio City, Inc., Campus District, and NEOC. We recognize the need in the community regularly for sanitation stations, and not just for the homeless. However, especially during these times, having access to appropriate hygiene is extremely necessary. So we're grateful that Ohio City, Inc. kind of stood up this initiative, and we to date have 11 locations that were strategically placed. They're in high traffic areas. They're close to some of the other service sites in our continuum, whether it be for food or day drop-in, and really are at the disposal to have the clients use. To date, we have not had too many issues with these units. We recognize it's such a great need, and we're grateful to have them through the remainder of the year. And we'll talk about this ongoing to see if there's not a way of having this permanent service to provide within the community. So that's just a quick snapshot of COVID. I know that was a lot of information, but I look forward to our discussion. If there's more questions, we can go back and drill down. So as we move throughout the summer and into the fall, we started to think about cold weather planning and trying to be proactive, COVID or not, really. So you'll see we started our planning group and planning committees back in late August. And that was comprised of various partners, Luther Metropolitan Ministry, NEOC, Metanoia, Community West Foundation, City Mission, Catholic Charities, Westside Catholic Center, and of course, my office. The point of this convening was to talk about not only seasonal shelter, but again, what does this look like during COVID? So from that planning group that met several occasions weekly, we determined, Metanoia is operating for this season in 3 sites, and they will help fill a gap. And in our discussion, we talked about what other gaps are we going to anticipate seeing within the continuum? What does the continuum need? And with that, the group determined that we needed a site that had elasticity. So if we had 2 individuals that needed to come out of the elements of the weather, this facility would be able to hold that. If we had an influx of maybe 50 to 60, we needed a space to be able to have that capability to expand. Secondly, we were looking at 1 facility for various reasons. That way it's logistically easier to operate and for the provider. And we were looking for something that was central to the rest of downtown homeless services. Thirdly, we were looking for a space that could hold up to 60 people. So again, it has that ability to be elastic. And lastly, we were looking at that time at a building that we could potentially have not just overnight access, but 24-hour access. So individuals would have a space to go during the day. After those discussions, we started getting to work on location search and confirming what site we would be at. We were grateful that several entities were exploring with us, CMSD and other entities in the community, just saying, what is the best ideal building, what can potentially be stood up the quickest. And Michael Searing will be covering our final destination and how we landed on that. So I'll save that for that. But in these discussions, once we did find the site, we said, well, who can help? And 2 providers, LMM and NEOC, stepped up and said, I'm able to provide this service at this capacity. And, we had a good foundation for stepping into this cold weather plan and operating this building in this partnership, because one of the hotels we had used for deconcentration specifically for those unsheltered, involved the partnership of LMM and NEOC. And it was a strong partnership that really allowed us to bridge at a time where we were just starting to use the hotels and increase the deconcentration effort that allowed us to carry it on. So I'm grateful for them both stepping up to the plate. And I know Chris will cover that a little bit more for you to describe that partnership. Moving forward. Lastly, so our cold weather seasonal plan this year is being funded through Cuyahoga County CARES Treasury funding, as well as the Community West Foundation, who I cannot express enough, has been involved through the whole planning phase, as well as on a financial level. And lastly, also through the City of Cleveland, who I believe is in their finalization of some CARES funding that will also attribute to these resources, which we have budgeted out and access to hopefully through April of next year, if all goes well. So we've really done some diligent planning this year to find a seasonal plan that meets the needs of the community and to be able to have access to that and the resources necessary in order to have that through April. I guess the last thing I'll mention that I think is important is that as we laid out this cold weather plan, we're not necessarily sure who to expect this year. Different from what previous years, each shelter is allowing individuals to remain inside at all times, not just dependent on weather. So we know that we're grateful for the hotels that we're currently using for deconcentration and that the main shelters themselves, congregate settings, are allowing them to remain. That'll hopefully bring a decrease. We also know that NEOC has worked extremely hard to get those that are unsheltered that are willing to come in to also be a part of that hotel initiative. And then lastly, I won't take Mike's thunder, but our seasonal overnight shelter capacity does have the ability to stay indoors and be 24 as well. So we're hoping that this at least decreases in the amount of individuals that will be out in the elements, and everyone will have a space to go, is our hope and intention.
Thank you, Director, and really appreciate your hard work, and clearly you've jumped right into that position. So thank you so much. Are we moving on now to Director Nestrick of NEOC?
We are.
All right, Chris, my friend, just before you start, if we can just, thank NEOC for all of the advocacy work that you guys do from, rooms with important people in them all the way down to the community members that need your help. You guys have been an incredible advocate. So Chris, please kick us off. Thank you.
Yeah, thank you so much, Councilman McCormick. And thank you, Melissa. NEAC is well known in the community for its advocacy, but we're also a service provider and we do street outreach work. And so, there comes a times when advocacy is needed. And then there comes a time where, you need to do the work to help our people that are living on the streets of, we've, thanks to a deep collaboration, we've been able to increase street outreach capacity in our community. We have more street outreach workers on the street today than we did a year ago. Some of that is, intentional because of COVID and wanting to keep people safe. And and then I think on the other side is, we have this year going into the colder weather, which we, mostly haven't seen too much of yet. We have a increased seasonal shelter capacity. And so that's really great news, more than we did last year and previous years. And I think that's because of, the collaboration that Melissa Cirac has been able to gather between everyone and really moving us into a plan that is really important given both COVID and the cold weather. I think on the same side, because of the ability to use hotels and, having more access to services, we do see a pretty, about a 30% decrease in unsheltered homelessness since March. And I think that's really good. I think we've, our street outreach services have both been able to use hotels, but also, get people directly into housing from the streets in different ways. From March to early on, we put, upwards towards 50 people into boarding houses in our community. And so, or, renting rooms in our community in different places. So that's been really, really helpful and been able to utilize many of, some of the rental assistance that has been in our community to get people into permanent housing. There's volunteer teams that continue to go out to check on folks and provide services. And that, I think there, as Melissa mentioned, there are some unknowns going into the winter season. I think just hearing the presentation from the hospitals, it feels like, we're just really kind of meeting regularly to identify emerging needs and to really figure out what's happening for folks that are sleeping unsheltered in our community. But needless to say, I think what is the great news we have here is that we are connecting with folks, we're identifying folks that are unsheltered, and that we have an increase. There's less folks out there, but there's also an increase in seasonal shelter capacity. And so just to kind of move on really quickly for the next slide, just to give you an idea is that, street outreach happens, there's the identification, initial engagement, and relationship building. There's basic needs, which now comes also deeply into wearing face masks and providing kind of the basic needs and services to folks. And then as our kind of goal is, we accompany them and give them access to both temporary shelter. We're still using all the regular shelter stuff, but then in the relationship, if we realize that, maybe they're, seasonal shelter seems like the best approach, then they're, quickly referred to and entered into seasonal shelter during this season. And then I think it's really important that all of our work is geared towards permanent housing. And, we're working kind of some of the partnership is, NEAC is for both the hotel and the seasonal shelter. NEAC is working to identify people and make referrals into the temporary shelter, and then kind of following up with them to get them in access to permanent housing in case management towards permanent housing. I think we saw a lot of success with the opening of the 2 new PSH buildings, that a lot of folks that were unsheltered and were able to be prioritized and put into permanent housing pretty quickly. I think upwards towards around 40 people were placed in permanent supportive housing through this kind of street outreach work. And so that's, I think we're seeing huge successes, not only, keeping people safe and, socially distanced, but also being able to work with them in new and creative ways to gain them access to permanent housing in our community. And so, I think that's kind of the work that we're going to continue moving forward is engagement, providing needs, accompaniment, and access to the seasonal shelter. Where LMM will be doing the operations, but that NEOC's outreach workers will continue to follow up to get them longer term services and and geared towards a housing first approach of permanent housing. And so, that is kind of our, I would say just want to, there's other, more outreach teams out there than NEOC. Frontline Services does a great job, but I think this is, kind of the relationship we're having to identify folks as much as possible to get them into our seasonal shelter. So thank you, everyone.
Yeah, thank you so much. And thank you for the great work that your teams are doing. Michael, if you could finish up the presentation for us, and then we will open it up for questions from members of council. We are running a little short on time, so I'm going to ask Michael if you can be concise, and then I'll ask members to do that as well. Thank you. Go ahead.
Great. Thank you, Chairman McCormick and the committee for having us present today. So we're really excited to be in partnership with NEOC and the Cleveland Hostel for the seasonal shelter response. You can see from the pictures there that it's a really nice place. So we're excited to have such a clean and vibrant, welcoming place for our people. The referrals, as Chris mentioned, all go through NEOC. And I just wanted to point out that Frontline Service is still doing the coordinated intake and assessment for everyone else who's seeking shelter, but for this very specific population, they do go through NEOC. We were able to open on time Wednesday, December 1st. So just last week was our first night. And that was actually like kind of the day of the big snowstorm. So kind of ironic that seasonal shelter would open right in the midst of that. We have been averaging 33 people per night, and we do have a capacity of 60 people. So I think we're in good shape on our numbers. On the next slide, I can just comment that we did look at HUD issued some best practices for seasonal shelter response, and that were some guiding points that we do. It is, so HUD recommends a non-congregate setting, and so being a hostel, we do have semi-private rooms. There is the opportunity to isolate or quarantine. Melissa mentioned we do have another site. If anyone tests positive, they can immediately get placed there. And we practice all of the social distancing. We have plenty of masks for people and do laundry and regular cleaning. On the next slide, let's see, we do have LMM Central Kitchen prepares the meals. We have spaced out the dining area with farther apart seating for social distancing, and just have as many cycles of meals for people to come to keep the numbers spread out. And then the last point on that one, the options for housing, it says when inclement weather subsides, that's HUD's recommendation, but thanks to NEOC, you're working on that all the way through. So we're hoping not to, hit a rush at the end of the season, which is geared for April 15th for housing. Chris and his staff are placing people in housing all along. There's just one last slide. Oh, and as Melissa mentioned, it is 24/7, as are all of the shelters now. And that is hopefully going to take a little bit of the burden out of the day drop-in centers that have their own social distancing issues. So people don't need to leave the seasonal shelter site. So I think the last slide is Melissa was just going to wrap up for us. Thank you.
Thank you. Go ahead, Melissa. Melissa, I'm sorry.
Okay, unmute.
Let's get you unmuted here, Melissa. Sorry about that.
Okay.
There
We
you
hope to eventually scale down from hotels. As you heard, from the other medical professionals say, the vaccination strategy, eviction crisis response, as the moratorium, if it is lifted this month, it won't come immediate. We imagine it'll be several months down the road when we see that true impact. Of course, we have been working along the way to expedite exits where appropriate from shelter or the hotel space, so moving people from unhoused to housed as quickly as possible. And lastly, of course, developing funding strategies as we move into next year and addressing the needs as they unveil themselves. So thank you.
Great. And thank you all for the presentation. It's very helpful. And I'll just say from a point of personal privilege, I want to thank the Cleveland Hostel and others in our community for working with the Continuum. We're proud to have the seasonal shelter in Ward 3 and look forward to more of these partnerships. So excited to do that. All right, I've got Councilman Anthony Brancatelli. Go ahead.
Thank you, Mr. Chairman, and also more of a compliment to really thank the presentation. I think it's great information that we can share with our residents, and also want to thank Chris and everyone who has helped us around Brighton Park when we were dealing with moving folks as they had taken shelter in that area as we're redeveloping. Just incredibly compassionate, and what's been set up and the infrastructure has been pretty amazing, and I'm very supportive for those in need. So I just wanted to pass that thanks along.
Thank you, Councilman. I've got Ward 15, Councilperson Jenny Spencer. Go ahead, Councilman.
Thank you. A comment and then just a quick question. My comment is just to thank the presenters. Michael, you're an old friend. It's so good to see you again. And Melissa and Christopher, it's so nice to meet you. I look forward to working with you. My question, I just want to make sure I really understand in terms of this really network of resources. If we have an individual in our community who we believe really would need access to these resources, who should my office call? Who should neighbors call? What's the point of entry to initiate assistance for that individual, especially when it always, in cold weather, it's always going to feel like a crisis?
Thank you for that question, Councilwoman. Melissa, do you want to take that? Again, you're muted, Melissa.
I'm so sorry. Actually, Chris, did you want to take that? Because you'd be the point of referral. So you'll speak in detail.
Thank you. Go ahead, Chris.
So we have street outreach services available. So, if you have someone that is, that is staying outside at this time, I think you should call NEOC's office, obviously, and then we can refer you to, we would, talk to you and then send an outreach worker out to them. I think it's really important to understand that, I think we get a lot of calls, actually for, the Detroit Shoreway Development Company used to call us a lot, and we would send folks out to work with folks in that area. And, we do that. And, I think we're seeing a lot of some new folks out there. So we appreciate all the calls we can get. It's important that you should also make sure that they know about coordinated entry, and that you're giving them coordinated entry as a phone. It's, you can't show up in person, but that they would have that number to call coordinated entry in our community and do that. And then, that's kind of something you can give them. And then you can also give them our number, and we can send out outreach workers to kind of engage with them on the spot if they need that or are not kind of interested or wanting to call coordinated entry. We can come, and then we can triage with them to either, get them access to the seasonal shelter.
Thank you, Chris. Go ahead, Councilman.
I think that was it. I just wanted to make sure I understood the, again, how to best partner. So that was a helpful response. Are those phone numbers in the presentation, or are they available to us for distribution after this meeting?
Yeah, and can you make sure that you work with our presenters today to have that information distributed to members of council?
Thank you very much.
Great. Thank you, Councilman Spencer. All righty. Do I have any other hands or folks that are trying to raise a hand that would like to ask a question of our presenters today? I don't see any. One thing that's actually, I got a tweet this morning asking about permanent supportive housing. So I'm curious to the presenters and the team. We have the immediate need with a cold weather plan, thinking about moving forward. I'd love to hear your thoughts in the last few minutes that we have here of this committee on where we are with permanent supportive housing, where we're going, and love to hear from that. So I don't know who, I'm going to throw that ball in the air, and whichever one of the three wants to take that. I don't know if that's a Melissa question. Go ahead.
If I can unmute, I did unmute. So, well, I'm happy to say that as a continuum, we offer over 3,600 PSH subsidies in various buildings and scattered units in our continuum. And looking at the buildings themselves and the Housing First initiative themselves, with the accomplishment of 2 sites that recently opened, Joseph's Commons as well as Harper's Point, we have reached our overall capacity goal with the Housing First initiative of 1,000 units for permanent supportive housing. So, previous director worked on that initiative for a long time in the community to develop enough housing for individuals. So at this point, I would say we're continuing to assess the need. There's a great amount of rental assistance as well being put into the crisis that we see forthcoming from COVID. And then in addition to that, there is opportunities to address housing for other populations coming up. So we're hoping for a TAY project with this transitioning aged youth project coming up that would house that population. So really, I think, we've done a great job. There's always more to do. And another piece that we'll see in working forward to increase access to housing will be the challenge of working with landlords. That has recently turned to be a challenge with COVID, and how do we incentivize them as we're looking through this crisis, and then on a more long-term basis. So that would be a quick answer, probably.
Thank you, Melissa. I appreciate that. And I'm thank you to Nate from Cleveland State on Twitter who asked us that question. Councilman Brancatelli, your hand is up. Go ahead.
Yeah, just a real quick comment, and I apologize if I missed this. During COVID, I know my son, when he was at St. Ed's, they did the Libre ministry and going out and serving food and providing some essentials. How is that being handled during COVID, or is that still continue? Is that on hold for now?
Chairman, may I?
Yes, Melissa, go ahead.
Okay, through the chair, to Councilman, our day drop-in centers have still continued to provide food. So most of them did pick up food for pickup during COVID, and the day drop-in center component did cease during March. Both Westside Catholic Center as well as Catholic Charities Bishop Cosgrove Center is working on their reopening plan to be open during the cold weather season. So they did continue to provide food. And as far as the day shelter component, they're ironing that out so that they can hopefully open as soon as possible. And Chris, I saw that you were going to comment as well, so I didn't mean to cut you off.
Just specifically on the Libre thing, different programs have done it different ways. We've been really kind of intentional in having conversations with the groups to really, whether, I think in the beginning, a lot of them shut down and then they opened back up, and now, but I think I don't think the students are going out because they're not in school, and I think it goes with the school kind of schedule. But I think on our end, we've been really intentional to have individual conversations with them around the appropriateness at this time to be doing that. And if they're going to continue, what type of kind of COVID precautions they're putting in place for their services.
Okay. Thank you.
If I just might add, I think that's been one of the challenges that we've seen since March in operating in a different way for all of the providers in our continuum is keeping, their staff safe and healthy, but really they've lost most of their volunteers, and the nonprofits in this community greatly rely on all of the volunteers to make the work happen and have those helping hands. So we do continue to struggle on that end and the appropriateness of it.
Thank you. And that's a perfect segue. I think I've got 5 minutes left on this committee, so it's a perfect segue to my last question to the presenters here today. For council members or for folks in the community that are watching, to the question of what can they do to help. So I'd ask each three of you to briefly respond to that. What can folks do to support the work you're doing or to contribute, whether that's monetarily or time or otherwise, to the work you're doing? Let's start with Melissa.
I would say first, of course, please feel free to reach out if you have any questions I don't want anyone ever feeling like they don't have the information that they need in order to respond to something. Secondly, I would just ask them and reiterate to let them know that they have a very strong continuum of providers in this community who has been doing this work for hundreds of years all put together, and that if there is a greater need that they'd like to contribute, whether that's time, advocacy, financially, to please look to us, because we are working very strategically, and we have throughout this whole crisis, and will continue to do so, and be able to gauge for them what our needs are really in the community at the ground level.
Thank you, Melissa. Chris.
Yeah, I think first and foremost, I think, go on our website and, a lot of the information, I think Councilwoman Spencer, a lot of the information you were asking is on our website to find out the information that you're seeking. I think at this time, we just need to be really, when folks find themselves in a housing crisis, come from a place of compassion and love when you're responding to them at all times. Obviously for a small nonprofit like ours, any financial donation helps. But I think, likewise that, I think familiarize yourself with the resources available in your community. We have a lot of housing assistance available in our community. There's a lot of resources that are available so you can help your neighbors at this time, and, be neighborly to folks at this time, and know the services that you can direct your neighbors to, because there's so many that are available.
Thank you so much. And then Michael, round us out here, please.
All right, thank you. That's a great question. So our volunteer program has taken a hit. We used to have about 2,000 volunteers a year, come to 2,100, and we're in process of really reshaping that. We're working with PCs for People to have a computer in every one of the hotel rooms where we have people. So we're planning to kind of reshape the volunteer program and have people still connect, help people with job search and different things, resume writing as well. Also, we have had reduced meals provided, usually like a lot of church groups and other groups. So some of them have actually kind of changed up their process, and they're giving us a financial donation to still be able to cover the meal. So that's been really helpful. And it's also available on our website. And my final comment, I just really appreciate the city and county's commitment to still finding a shelter bed for everyone who needs it. That's not true in many communities, and especially needed now during COVID. Thank you.
Thank you. Michael Searing with Lutheran Metropolitan Ministries, Melissa Cirac of the County Office of Homeless Services, and Chris Nestrick of the Northeast Ohio Coalition for the Homeless. Thank you all so much for the good work that you're doing and your folks are doing on a daily basis, and for sharing this update with us today. With no further questions and running up on our timeline here, I want to thank everyone for putting up with my first Health and Human Services Committee as chairperson. Hopefully it went as smoothly as possible, and to the members for being, nice and not lobbing on too much on us here. But no, again, really appreciate everyone's time today, and to all of our presenters in the first section as well with the updates on COVID-19. Thank you so much. Wear your mask. As Chris said, be neighborly, love each other. And Madam Clerk, this will adjourn our Health and Human Services Committee.